this age of data science, with machine learning and artificial intelligence and all the good things, I strongly believe that data is the key, or even I would go to the distinct and say like it's the king of healthcare industry, right? To better use these industry's trends in utilizing the data, one should have better understanding of the meaning of the data elements, their appropriate use, the sources as well as the formats in which you receive the data. The most common data sources which people are using is like the EMR data or the electronic medical records. Sometimes people call it as electronic health records, followed by the payer data, like which is like claim files, the medication files, and also there is a data from the health information exchanges, which is which they call it as the transitions data. The biggest challenge is to collect all these data is key to understand them and then how you are going to use them, or the workflows of how these data elements is used. Based on the workflow or the use case, the priority of data consolidation has to happen, and a flexible platform which knows how to process these and gives the priority based on the priority and are the most important factor for normalization, the standardization with various coding systems which the healthcare is using. It's not just like one ICD or CPT. They have like SNOMED codes, LOIN codes, RX norms, and so many other codes, and then there is unstructured data. So that's the challenge which this industry is facing. And coming to what is holding the organization back from making the right use of data, right? There are 4 things which is really important. One is people need to understand what these data elements, like not just data, the elements, each element in the data from various different sources such as EMR, PM systems, the claims files from the payers, the medication files from the payers, and then the HIE files, right? So a better understanding, then the ability to extract, process the data, both as structured as well as unstructured sources like the PDFs, the images, and then notes in some sections in an EMR. The third one is like a robust system, or even in IT they call it as platform, to consolidate the data in the correct order as required by the use case for a client, right? And then the key element is people, right? You need a team who can understand the data and also how it is stored in an EMR database to extract the key elements, and then ability to read the payer files and decode that before then you should start the programming, right? So as I said, like it's like 4 important things which is holding most other companies: understanding of the data elements, ability to extract and process, a robust platform, and then a team members who understands the data and use it the right way. There are a lot of vendors who claim that they have data from this EMR, that EMR. I get like 10 and 20 emails a day, and when I talk to them, I find that like they really struggle. They get only what everyone can easily get it, and that's not enough for doing this for population health or like whatever the healthcare industry is demanding. They struggle to extract the core data, not only like structured one, but the unstructured one, right? So they need to understand the different pair format, the files coming in, and then like the elements in it. So the key, I don't think like anyone is in the market says like that they can get all the data like what we do. As I was discussing the other points, Persivia understands the value and the intricacies of data in healthcare. We focus on the basics, which we call it as the 3P. One is people, process, and platform. When it comes to people, our team members have vast experience and knowledge in data, including multiple sources, the formats, and also the workflows or use cases to which a particular data element or a data set is being used. Next comes the process. We have a robust process to ensure the data extracted and processed goes through a validation in all the steps. Based on the data quality from the sources, we ensure to perform crosswalks, normalize the data as well as standardize them before it makes into the client facing. We perform periodic validations to ensure the data quality is maintained at a high level, understanding that the EMRs give a new versions every often, and then like the pair files can change the columns. So periodic validation is a key, and before the data enters into our system, as well as like it goes outside of the system to the client, where the client can see it in the user interface. The third P is the platform. One of our strongest thing is our engineering team. They are not only strong technically, but they also have very good understanding of the US healthcare industry, as well as including the use cases as well as the workflows followed by different clients. They closely work with our internal teams such as the account executive teams, the implementation team, as well as the product team to ensure they know the latest requirements from our clients, and they deliver the solution real fast using the agile methodologies.